Hey guys, welcome back to my YouTube channel. In case you are watching this video for the first time, please consider clicking that subscription button and also comment, like my video, share. Tell me in the comment section what you want me to talk about in the next video. And so today guys, I want to talk about danger signs in pregnancy. I know some of you have been told about them, but just remind them even if they know. So the first sign is vaginal bleeding. This can be a sign of miscarriage or abortion. So if you see this sign, please go to the hospital or go to a gynecologist so that you can get help before you lose pregnancy. Number two can be convulsion or fits. Yeah, or seizures. This can be a sign of preeclampsia or eclampsia, and maybe you don't know, so you should consider going to the hospital so that you can be managed well, so that you carry your pregnancy up to term. The next thing is severe headache. Severe headache with blood vision. Maybe you are not able to see well and you usually don't have eye problem. This can be a danger sign in pregnancy and can cause you. So if you see this, please consider going to the hospital. Also, it can be sign of hypertension in pregnancy or preeclampsia in pregnancy. So when you see this, please consider going to the hospital. Number 5 is fever. So fever is also a high fever, of course. This is also a danger sign in pregnancy. It can be alarming some infection, or it can be maybe the condition is in pregnancy. So if you have high temperature or hotness of the body, please consider going to the hospital. Number 6 is severe abdominal pain. Severe abdominal pain can be a sign of miscarriage, or it can be a sign of placenta previa. This is a condition where the placenta is detaching from its original situation before term. So you consider going to the hospital if you have severe abdominal pain. Number 7, is difficulty in breathing. Can be another sign of other conditions in pregnancy. So please, if you realize you are having problem with breathing, please consider going to the hospital. And also another one is edema. Edema can be a sign of preeclampsia or hypertension in pregnancy. Please consider going to the hospital if you realize you are having edema. Not edema only on the lower limbs, but edema of the whole body, the face, the hands, the legs, the abdomen, the whole body. Let me just say the whole body. So if you realize that you are having some edema or your body is swelling, please consider going to the hospital, because you can be having hypertension or you can be having preeclampsia or preeclampsia when you are pregnant. And you know this condition are always dangerous when you are pregnant. So if they are not managed, you can lose your pregnancy, or even you yourself, you can die. And another thing is severe vomiting or hyperemesis gravidarum. Yes, vomiting in the first trimester is always normal, and if it is severe, you might be having another condition which should be diagnosed and you be managed before you lose your pregnancy, or before any complication arise. So vomiting is normal, but severe vomiting is not. It's not normal. You should go to the hospital when you realize you are having severe vomiting. And what do I mean by severe vomiting? Severe vomiting is when you cannot eat anything. You vomit from morning to evening, even at night. You vomit. You are vomiting everything every time. That is when we will consider it as severe vomiting. And then another sign is the absence of fetal movement. You know that the baby start kicking at 16 weeks or 20 weeks. So if from 20 weeks you are not experiencing any fetal kicking, please consider going to the hospital. You might be having another problem. And the last one is rupture of the membrane or water breaks. If water breaks when you are at term, you can go to the hospital because you might be in labor. But if water breaks when you are still not at term, you should go to the hospital because there is a serious intervention that should be done. So you should go to the hospital so that you can be helped. I think those ones are some of the danger signs that someone can experience when she is pregnant and should consider going to the hospital or going to see the gynecologist. So please, thank you for watching. Let's meet in my next